Next one is the gastric bypass. This is the Cadillac procedure of bariatric surgery. It's both a restrictive and a malabsorptive procedure. It involves cutting and stapling of the stomach and intestines. There's no foreign body. It can be reversed. And there's something called the dumping syndrome, which essentially means that in a normal stomach, there's a valve called the pylorus. And once the food is digested in the stomach, the valve opens slowly and lets a little bit of the digested food into the intestine to be absorbed. Well, when there's a gastric bypass, there is no valve. So all the food that's in the stomach goes immediately into the intestine, and the intestine doesn't like it because it's too concentrated. And as a result, fluid comes into the intestine and the intestine swells, causing pain. And then in a few minutes, you'll also be getting severe diarrhea. That's why it's called the dumping syndrome. It occurs if you eat lots of sweets like cakes and ice cream. So patients who have had gastric bypass are warned not to eat a lot of ice cream or cakes or anything super sweet. Let's watch a video now of the gastric bypass.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure.